Hello, my name is Giselle Gomez, and I'm a medical student who will be presenting our work on the impact of COVID-19 on presentation, management, and outcomes of acute appendicitis. So to start, we know that COVID has significantly impacted patient care, but the specific impacts on the surgical management and outcomes of conditions unrelated to COVID-19 are still unknown. We assess the impact of COVID-19 on the different aspects of surgical care for acute surgical conditions. Specifically here, I'm going to talk about appendicitis. For methods, we performed chart review using the Stanford Research Repository and gathered information on patients presenting with acute appendicitis to the Stanford Emergency Department between March through June in 2019 and March through June in 2020. And we chose this time frame because March is the month that the first stay-at-home order in the country was passed, and this was here in Santa Clara County. And then we chose June because of the policy changes that happened as we saw the pandemic unfold. We collected data involving patient demographics, symptoms, severity, preparation status, treatments, and post-operative courses. And relationships between variables were assessed by calculating R correlation coefficients and performing t-tests and chi-squared tests as appropriate. On the right, you can see our selection criteria with the different included patients from ACS, ICD-9, and ICD-10 diagnosis codes. And then we excluded any patients who did not present to the ED during this time frame and whose ED diagnosis was not appendicitis. And this left us with 182 patients in 2019 and 179 patients in 2020. For the results, I've broken it down into presentation, management, and outcomes, different aspects of the surgical care and course. So in presentation, we did not significantly see a change in the number of patients who presented to the ED with acute appendicitis. So 182 versus 179, 3-person difference. We did not see a difference in a longer duration of symptoms either, 2.2 versus 2.7, which was insignificant. An Alvarado score, which is used to grade the likelihood of appendicitis, we also did not see a difference, as you can see in the first two graphs. However, when we look at the ED severity score, the ESI, we see that there was a more severe score in patients presenting in 2020. And that was 2.37 versus 2.67, but this was actually very significantly significant. We saw that the ESI score was lower for patients in 2020, and we considered anything to be emergent as an ESI score of 1 or 2. And as you can see, we had 63% in 2020 with a score of 2 or 1, and 13% in 2019, which means that every other person presenting had a score of 3 or more. And this just makes us believe that patients who were presenting, while maybe not having duration of symptoms prior to presentation that were longer, were presenting with more severe cases of appendicitis. We also noticed that at presentation, patients were diagnosed with ruptured appendix in 2020 more so than in 2019. This was a 20 versus 16%, but also statistically significant. And this is at presentation. So with imaging, we found that these patients had ruptured appendices. Moving on to management, we didn't see a significant difference in the rate of hospital admission, 96 versus 97%, or surgery between 2019 and 2020. So in 2020, we saw 87% of the patients getting surgery and 82% of the patients getting surgery in 2019. And again, this was not statistically significant. So while management did not change during COVID-19, we did still have those more significant cases. Outcomes, however, we did see a differences across different aspects. While there was no significant difference in the total length of hospital stay in 2019 versus 2020, about 3.2 days for either, we did find that a greater number of patients in 2020 were discharged on antibiotics in 2020 than in 2019, and this is post-operatively. This is 29% versus 19%, and that was statistically significant. And we also found that representation rates increased in 2020 compared to 2019. And this is also statistically significant, with a 13% in 2020 representing versus a 4% in 2019. And we found that to conclude, we found that patients during the COVID-19 pandemic were presenting to our institution with acute appendicitis and had higher severity scores, implying a more severe disease presentation. They were more likely to have a perforated appendix at presentation, and they had higher representation rates than patients who presented during the same months in the year immediately preceding the pandemic. Our future directions are to continue looking at how the pandemic is shaping outcomes of acute surgical conditions. We looked at the first initial 4 months in the US, specifically here in Santa Clara County, but in other locations, because our data is geographically limited, we could find out more about how different areas dealt with the COVID pandemic that also was different in its outcomes. So we must collect further data to analyze how different policy changes affected patient care in the acute surgical setting. We've seen different policies popping up in the last couple of months, and the policies seem to change as we get surges of COVID-19. So it'll be interesting to look forward to seeing data on that impact on acute surgical conditions. Thank you.